They have saved a lot of people overdosing here. I've seen it. It's an amazing place to be.
Some call it a radical approach, reaching out to people who use illicit drugs by giving them a safe place to do it. And tonight, Our 11 News Investigates exclusive series continues on chronic pain, Maryland's opioid crisis. Baltimore leads the nation in opioid-related deaths.
And one idea the city leaders are looking into, it's called supervised consumption. It's a place where people use illegal drugs under the watchful eyes of medical professionals.
And Baltimore city leaders have been checking out these kind of facilities in New York City. And we do want to warn you, this is a very raw look at the crisis and the realities for people in the throes of addiction.
Sure, and this may be graphic for some viewers. 11 News Investigates reporter David Collins got an inside look at how it all works.
Participants bring in their own drugs. They sign in, write down what they're using. The goal is to keep them alive until they're ready to seek treatment on their own.
Operators say it's a place where lives are saved.
It's a health intervention. I mean, literally, it's what it is.
A judgment-free zone where lives are changed.
They helped me get my resume. They helped me with surgery, put a few dollars in my pocket. They fed me 3 times a day.
On Point NYC, a nonprofit, operates 2 facilities in New York City that provides a safe place to shoot up, smoke crack, or snort. They are funded through the New York Health Department, federal grants and donations.
What does On Point do for you?
Gives you a safe space, gives you people that are actually going to help you. It's better than being on the street where you can just do too much or do something you don't know and just pass out and get everything stolen from you.
They call the drug ingestion area the OPC. Everyone who works in this section has a medical background.
Fentanyl.
They test for a variety of substances, often mixed with illicit drugs that can trigger an overdose. They call this a buffet tray. It's full of sterile material that can be used to help ingest a variety of drugs. Mike says he comes here because it's sanitary. On the street, he fears getting HIV and other diseases linked to dirty needles.
So what I do is I get a $10 combo, which is 2 Cokes and 1 heroin, and I shoot that up together.
The centers have been used more than 150,000 times by more than 5,300 participants. The centers have successfully intervened in more than 1,600 overdoses.
This is our crash cart. This is what we use to reverse an overdose.
Latonia Jacobus is the managing supervisor of the OPC. There are 8 booths and a smoking room.
All the booths are equipped with mirrors and lights. The mirrors are there for staff mainly to stand in a particular part of the room where we can see each person in every booth.
They stand behind the mirrors to check on users every 3 minutes. If they see any sign of an overdose, they respond immediately with oxygen.
On fentanyl, you clench, your jaws close up, so we have to use our hard skills.
Narcan is rarely used, and when it is, only a quarter of a dose is given because it rids the body of the opioids.
When you use Narcan, you're going to go into a withdrawal, which is very dangerous because they get up angry, they're now dope sick, and they don't know how to respond to you because you just made them lose their money.
The operators of On Point NYC say the OPC doesn't work by itself. Wraparound services make it successful.
A lot of our clients come in with needs like wounds, abscesses that require medical attention. We have medical doctors here and we have psychiatry as well. Me personally, I do mental health. We also have mental health counselors. We also have social workers.
So we know everything that our folks are using is synthetic and unpredictable. The only true prediction we're receiving right now is that people are dying at alarming rates.
Sam Rivera, the executive director of On Point NYC, is the glue that holds it all together. He says Baltimore has toured the facility more than anyone in the country.
So the holistic approach is as something that seems as simple as showers. And we do the laundry for our participants. Having an address for them to use, to receive paperwork. The community said they don't want public drug use. We agree, by the way. See, we're not at odds with that. They don't want paraphernalia in the community. We agree. They don't want their children to have to see this we agree.
Police approach drug misusers with cards promoting On Point NYC and sometimes escort them there. Rivera hopes to make this a 24/7 operation, open a pharmacy, a barbershop and salon, and continue to hire those who have come through the place and are now clean and sober. Bobby is one of the participants hoping to get hired. He's a recovering heroin user.
They have saved a lot of people overdosing here. I've seen it. It's an amazing place to be.
Under current state and local law, community organizations may only provide needle exchanges, education, and disperse Narcan and naloxone. But during this upcoming General Assembly session, lawmakers will be considering a bill to establish a pilot program for 6 overdose prevention sites, like this one, in the state. For 11 News Investigates in East Harlem, I'm David Collins.
All right, David, thank you. And you can follow this week's special series on the opioid crisis in Maryland right now in the WBAL TV app. Our infographic explains how you could help save lives and how to get resources for those in need.